Hi, it's Todd Hartley for Breast Cancer Answers, and the man next to me is Dr. Laszlo Tabar, the world's leader in breast mammography. Dr. Tabar, can you give us a demonstration, show our audience the value and importance of routine screening mammography?
I do it with pleasure, Todd. First of all, we really don't want to go back to the dark ages of mammography screening as the Canadian trial tries to mislead women. Answering your question, and if you look at this slide, for 5,000 years, cancers were as big as you see on the slide, or even bigger. And this is the only generation of physicians in the history of medicine that can make a significant difference for women through early detection. I mean, anything that is a living creature like cancer or human beings that are grown up must have been a child. And I'm demonstrating here a breast, a woman's breast, who already has the disease, but she doesn't know about it. That's what we call the baby cancer.
And we want to get the baby cancers, not the mean adult cancer.
Any time between the picture on the left side and the right side, because scientific trials clearly showed, and anybody with a common sense understands, that large cancers that are already spread on either in the axilla or in the body cause harm, and unfortunately they might kill women. So the main purpose is, answering your question, get rid of the big cancers, because then we reduce breast cancer death.
It's just that easy.
Well, it's not easy to prove, but there are the scientific trials that clearly showed, beyond doubt, that when cutting back on the advanced cancer rate, that is arresting the process any time between the picture on the left and the picture on the right, we are going to cut back on the harm caused by breast cancer. Let me show it again on another case. You see the deformation of the breast right there, and we go back in time, and that's what we want to accomplish. Unfortunately, we are not good enough to prevent breast cancer.
So the one on the left is the baby cancer.
Yes.
The one on the right is the aggressive adult cancer.
Correct.
And routine screening mammography allows you to catch the baby cancers in time to help increase your life expectancy.
Correct. Not only that, but cutting back on breast cancer death. And the mammographers would demonstrate this way. That is, on the right side, I just enlightened now, is the advanced cancer, and the small cancer is here. And that is the growth rate. And fortunately, breast cancer does not grow that fast. So we have an option to act in between. So here we go, on a time scale. You see the years on the bottom and the number of years that it takes before the baby becomes a grown-up. And we have scientific evidence showing clearly that 30 to 40% decrease in breast cancer death can be accomplished, provided that women come to regular mammography screening.
Interesting. Okay, so look, I'm a layperson. I'm a digital marketer in the health space. I don't understand that last slide that you just showed. Can you explain it to me in simple terms?
With pleasure. That is, in a scientific trial consisting of 133,000 women. They were randomly selected. You are allowed to come to mammography screening, you are not allowed to.
Wow.
That's the control trial. We could do that 29 years ago in Sweden. And those who were invited, some of them didn't come, and some of those who were not invited had a mammogram contamination. But when at the end, after 29 years, you compare how many died in the group invited, that's the blue line, and how many died in the group not invited, that's the red line. And there is a significant difference, which means it's not caused by chance. It is a true benefit. That is, invitation to screening, and especially those women who come to screening benefit by less radical treatment, by decreased mortality, and by many other benefits.
Well, he's Dr. Laszlo Tabar giving us an excellent overview on why women need to have routine screening mammography. Make sure you put that as part of your annual process starting at the age of 40, right? That's when it starts.
Correct.
Wonderful. Thank you very much, Dr. Tabar.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.